Just be happy with who you are. Just be happy with who you are. Just be happy with who you are.
Hi, and now we're going to start in dissociative and somatic symptom and related disorders. And this is part 1. Now, dissociative and somatic symptoms and related disorders are historically linked with anxiety disorders as a form of neurosis. Anxiety is expressed directly in different forms of anxiety disorders, but its role in dissociative and somatic symptoms and related disorders is inferred. Now we're going to start with dissociative descriptions. The theoretical perspective and treatment will be in part 1. Part 2, we'll look at somatic symptom and related disorders. Consider this. Sally is 28 years old and is a student who was found unconscious by her roommate. Now, Sally was not able to remember her identity or any information about her life. Examination showed no neurological abnormalities or evidence of substance use. She remained amnesiac for 10 months until a clicking sound of her tea being stored triggered memories of her mother, and later more memories of other aspects of her life returned. Now, Little Just is a young girl who laughs and giggles. Gravelly Voice is a man who speaks with a raspy voice. The one who walks in darkness is blind and trips over furniture. Bid Judy is articulate, competent, and funny. Now these, I know that sounds kind of peculiar, but these are 4 of the 44 personalities that existed within just Castanelli. Now, she was initially diagnosed with schizophrenia, but was later told that dissociative identity disorder was the appropriate diagnosis. Now, she is a singer, she's a musician, she's an inventor, an artist who has become a lay expert on mental health issues. Now, normally speaking, there is a unity to consciousness that gives rise to a sense of self. We are who we are, and it's our sense of who we are. We get a good consistent, and there's a unity about who we are. Now, we perceive ourselves as progressing through space and time, but in dissociative disorder, one or more of these aspects of daily living is disturbed. Sally and Judy are examples of 2 dissociative disorders. Now, let's find out more about these disorders. Dissociative disorders involve changes or disturbances in identity, memory, or consciousness that affects the ability to maintain an integrated sense of self. Now, dissociative disorders include dissociative identity disorders, dissociative amnesia, and depersonalization realization disorder. We'll start with dissociative identity disorder. In dissociative identity disorder, sometimes referred to as split personality, 2 or more distinct personalities, each possessing well-defined traits, memories, and exist within the person and repeatedly take control of the person's behavior. This is also formally known as multiple personality disorder. Now, each of the personalities usually shows an integrated functioning on cognitive, emotional, and behavioral levels. Now, often there is a dominant personality and subordinates, and it involves a severe alteration, as you can imagine, and detachment in identity, memory, and consciousness. There can be the adoption of several new identities. Now, these identities display unique sets of behaviors, even voices and personalities. Now, it involves what are known as alters. Now, alters, which refer to the different identities or personalities in a dissociative identity disorder individual. The host is the identity that seeks treatment and tries to keep identity fragments together. A switch is often when an instantaneous transition from one personality to another. Now, there was a book, and I think it was a movie as well, Three Faces of Eve, and another book by the name of Sybil, and they're celebrated examples of dissociative identity disorder. However, there has been some more research and questions about the frequency and the fallibility of some diagnosis. Dissociative identity disorder is rare and seems to have a North American tendency, and that usually can be a bit of a trigger point for some researchers. And Nick Spanos of Carleton University in Canada didn't think multiple personalities was a distinct disorder. Instead, he saw it as a form of role-playing. First, individuals would see themselves as having multiple selves and would act in ways consistent with how they thought the disorder was. Then, intentionally or unintentionally, a therapist or counselor would reinforce the thought that multiple personalities were at play. And so that just brought into question, and it hasn't really been resolved in any satisfactory way. Now, dissociative amnesia, this is another form of dissociative disorder. This involves the loss of memory or personal information. The person experiences memory loss in the absence of any identifiable organic cause. General knowledge and skills are usually retained, but there are 5 types of dissociative amnesia. There's localized, selective, generalized, continuous, and systematized. In what is known as dissociative fugue, the person travels suddenly away from home or a place of work, shows a loss of memory for all of his personal or all of her personal past and experiences, experiences identity confusion, or even takes on a new identity when they make this travel experience. It's quite unusual. It doesn't happen too frequently either. Now, sometimes people may say they do not remember events or things, and pretending amnesia is known as malingering. Faking illness so that to avoid or escape work or other duties, or to obtain benefits. So malingering isn't just unique to dissociative disorders. Malingering is a term that's used for a number of different psychological disorders where people, they're really trying to avoid things or they're faking an illness, and it's not an easy thing to do. Oftentimes people who are malingering, it can be found out. Now, the third feature, or the third type of dissociative that I said we would touch on, is depersonalization/derealization disorders. And it involves persistent or recurrent episodes of depersonalization, derealization, or both, that are of sufficient severity to cause significant distress and impairment in functioning. Now, remember from Chapter 1, that's one of the primary conditions of the 6 that we talked about. Depersonalization involves feelings of unreality or detachment from one's own self or one's own body, as if it were a robot or functioning on automatic pilot or observing oneself from the outside. You don't feel connected to yourself. Derealization, there's a loss of the sense of reality in one's surroundings, experienced in terms of strange changes in one's environment. For example, people or objects are changing size or changing shape, or in the sense of passage of time. Episodes of derealization are characterized by the sense of one's own surroundings having become strange or unreal. For example, the colors may seem washed out or even very bright, and at times may seem to be oddly slowed down or even sped up. Now, so how might these experiences be explained? Well, let's check our theoretical perspectives. The psychodynamic theorists, they view dissociative experiences as a form of psychological defense, by which the ego defends itself against troubling memories or unacceptable impulses by blotting them out from the consciousness. There is an increased documentation of the link between dissociative disorders and early childhood trauma, which lends support to the view that dissociation may serve as a way of protecting the self from troubling memories. Many people who have written about dissociative identity disorder can link some of the personality splits off to childhood traumas, that the best way to cope with the circumstance was to hide behind another personality, if you will, and to develop those traits and that new reality that could cope with or deal with that trauma. Now, to learning and cognitive therapists, dissociative experiences involve ways of learning not to think about certain troubling behaviors or thoughts that might lead to the feelings of guilt or shame. So relief from anxiety negatively reinforces this pattern of dissociation. Social learning theorists and cognitive theorists suggest that multiple personality may represent a form of role-playing behavior. Some dissociative states, like dissociative amnesia and fugue, may be transient and terminate abruptly. So, what about treatment? Let's stop there. Are we doing treatment separately? I think we're doing treatment separately. Maybe we'll continue on and we'll do this all as one. So what about treatment of dissociative disorders? Psychodynamic approaches help the individual uncover and cope with dissociated painful experiences from childhood. Little is known about what works, what will work, as there is very few examples of dissociative identity disorder by which to try things out, if you will. Now, research suggests that cognitive behavior therapy and some types of medication may be helpful in treating depersonalization disorder. The biological approaches focus on the use of drugs to treat the anxiety and depression often associated with the disorder, but drugs have not been able to bring about a reintegration of personalities from those experiencing dissociative identity disorder. Now, psychologists will work with the dominant personalities and try to invite the other personalities together to integrate. The goal, of course, would be reintegration. All right, so now that's a quick review, just looking at dissociative disorders. We'll do part 2, and we'll do another review of just looking at the somatic symptoms and the related disorders for part 2. All right, everybody, keep up the good work. Bye now.